So in treatment of varicose veins, the first step is conservative treatment and the other is surgical modality. So when the patient has initial stage of varicose, like it is reticular veins, there are not too much of dilatation of the veins, patient has no pigmentation or no ulcer formation, then conservative treatment works best. So in conservative treatments, you are generally given compression stockings. So what you do is you wear compression stockings. You have to avoid standing for long, you avoid running too much, or whenever you have to run you wear compression stockings. You are on some sort of medications, generally for pain relief or to reduce the heaviness. When you lie on the bed, you raise your leg when you sleep. So you generally keep a pillow or two below your leg by keeping a pillow when you sleep. So these are the ways of treating conservative management of varicose vein. I'll again repeat, conservative treatment includes first avoiding prolonged standing, avoiding running, wearing your compression stockings. For most of the day, you can remove your compression stockings when you lie on the bed, and when you are on the bed, your legs should be raised and your head should be flat so that blood moves towards the heart and these veins are emptied. And of course, if you have pain or if you have any other symptoms, so accordingly certain medications will be given to you. So the surgical management of varicose veins. So now, who requires this? When a patient's veins are hugely dilated, they have difficulty in walking, they feel there is too much of heaviness in the legs, or it has started to cause a lot of pigmentation in the lower half, or there is a formation of a varicose ulcer. So these are the prime indications when you require a varicose vein surgery. Now there are different ways of doing it. One is a conventional method. In conventional method, you used to do stripping of the varicose veins. There used to be multiple cuts along the legs and you used to strip the vein and take it out. So it was one of the only methods of treating varicose veins till a few years back, and now things have changed. So the problem with conventional surgery was it used to leave you with lots of cuts, there was lots of bruising in that area, and of course you had to do prolonged bed rest. So these were generally the issues, and of course it used to pain. So these were generally the problems with conventional surgery. So now what you have is the latest laser modality. There is radio frequency ablation of varicose veins also being done, but now laser, what we use is a diode laser. So this is currently the most advanced way of treating a varicose veins. So what do you do in laser? Laser fiber is a very thin fiber which is approximately 600 microns. There is a small hole which is created along the entire course of the leg, generally above the ankle or in the mid half of the region. The laser fiber is inserted in the angle and the vein is closed. So with the laser, the entire vein is closed. So generally it is just a 20-minute procedure. It's a daycare surgery, so you not have to stay in the hospital. You are allowed to walk within a few hours and you can start doing all your normal activities from second day itself, all your normal activities from same day. So these are the basic advantages, plus there will be no cuts in the laser, pain is extremely less when you think of a laser ablation, and there is no bed rest which is to be done. So laser currently is one of the best ways of treating varicose veins universally.